Hello everyone. And this is going to be the preliminary round for the TACO PG quiz for Drishti 23. I request all the postgraduates to occupy the seats in front. And please leave the seats in front for the postgraduates alone. Yeah, it would be, please sit separately. Don't sit bunched up together. Anyway, it's not going to give you an advantage bunching up together because only one team from each institute will get into the final 5. So may I remind you that the questions need to be answered on a piece of paper. Please make sure that you mention the name of your institute and also the name of your team members, at least one team member, because there may be more than one team from each institute. We need to know which particular person has written those answers. So the first thing you do must be to write your name on the piece of paper. Please keep the answers legible and to the point. And please try and settle down as soon as possible. Each team must have 2 members. I can see some teams with one single member. And may I say that we have Harsha and Dr. Harsha and Ms. Prajita to help me with the proceedings today. We also have Dr. Aiden, Dr. Reshmi Bhaskar, Dr. Thomas Arun Varghese, who have kindly, agreed to help with the marking. I can still see one team with one member alone. Anybody if your partner hasn't come yet, please raise your hands. I have a lot of people. Please come forward. You have to be seated in front on one of the desks. Dr. Dilesh will also be helping me with the marks. Dr. Allen has also helped, will also be helping me with the marks. So are we ready? All teams, is any team not ready? Any team not ready, put your hands up right now. You can see 2s in every row. And I'd request all the consultants or other doctors from the same teams to be away from the teams so that they can answer in peace. So, are we all ready then? So we'll go to the rules then. Rules are pretty simple. There will be 30 questions in all, 15 MCQs and multiple choice questions, 15 single answer questions. There are no negative marks. The team with the highest marks, the top 5 teams make it to the final. However, no 2 teams from the same institute, according to KSOS rules, can make it to the final. So if 2 teams from the same institute qualify within the top 5, the second team will lose, the team in second place will lose out. Now, in case of a tie, the team with the highest marks in the second section, that is in the single answer questions, will go through. If there is still a tie, the team with the lowest number of answers will go through. And if there is still a tie, I'll do a tiebreaker separately on another day. All right, are we ready then? And please make sure you write once again, write your team name your institute's name and the name of at least one member of your team so that we can identify who has given the answers. Preferably both your names. Yeah? And at the end of time, please put your pencils or pens down. Anybody found to be writing after the time is up will be disqualified automatically. All right, so here we go. First question. Which of the following formulae is the least preferred for IOL power calculation in a nanophthalmic eye? Is it A, Hoffer-Q, B, Haigis, C, SRKT, or D, Barrett Universal 2? Which of the following formulae is the least preferred? I'll be displaying the question only once. And we're going to the next question now. Which of the following is true? The effective power of a concave lens decreases as it is moved away from the eye. B, the effective power of the convex lens increases as it is moved towards the eye. C, both of the above. D, none of A and B. Which of the following is true? All right, then we're moving to the next question. Which of the following is true about this picture? This is the frontal plane position. Glass prisms should be held in this position. C, both of the above. D, none of A and B. Which of the following is true about this picture? Please make sure you have the question number written alongside the answers. Next question. The odds ratio of POAG prevalence between people of African descent to white subjects is 2.82, with a 95% confidence interval of 2.14 to 3.72. Which of the following is true? A, 5% of white subjects are more likely to have POAG than African people. B, POAG is 97.18% more prevalent in Africans compared to white subjects. C, POAG is 2.82% more prevalent in Africans compared to white subjects. Or D, POAG is 2.82 times more prevalent in African people compared to white subjects. Which of the following is true? Right? It's a long question, so I'll give you some time. And we'll move on to the next question. Which of the following is true? A, an unaffected father and a carrier mother with an X-linked recessive disease have a 75% chance of having a child who is a carrier. B, a disease that has mitochondrial inheritance can only affect females. C, all males carrying an X-linked recessive gene are affected. D, homozygotes for autosomal dominant diseases have less severe symptoms. Which of the following is true? All right, let's move to the next question. Question number 6. The superior oblique makes an angle of how many degrees with the optical axis? A, 23 degrees, B, 67 degrees, C, 15 degrees, or D, 51 degrees. The superior oblique makes an angle of how many degrees with the optical axis? Just had a strabismus session before, so it should be easy for you. Next question. Facultative hypermetropia is A, that part of hypermetropia which cannot be overcome by accommodation. B, is the difference between total and absolute hypermetropia. C, should be left uncorrected in accommodative esotropia. Or D, is due to the resting tone of the ciliary muscle. Which of the following is representative of facultative hypermetropia? Right, I think that's enough time for the question. Moving on to the next one. Which of the following is not derived from the neural crest? A, sphincter pupillae, B, endothelium, C, lens, or D, ciliary muscles. Which of the following is not derived from the neural crest? It's a pretty short question, so not taking too much time on it. Moving on to the 9th question, which is the largest branch of the ophthalmic artery? Is it A, the anterior ethmoidal artery, B, the posterior ethmoidal artery, C, the lacrimal artery, or D, the central retinal artery? Which is the largest branch of the ophthalmic artery? I request the delegates to leave the front rows for the postgraduates who are participating in the quiz. Right, let's move to the next question. Which of the following regarding the lacrimal pump is true? A, pretarsal orbicularis pulls on the lacrimal sac to create negative pressure. B, puncta and canaliculi open to cause tear fluid to enter them when the lid closes. C, preseptal orbicularis compresses the canaliculi and puncta. Or D, lacrimal sac collapses when the eyelid opens. Which of the following regarding the lacrimal pump is true? I think that's enough time for the question. Moving on to the 11th. Which of the following fungi have septate filaments? Is it A, aspergillus, B, mucor, C, pythium or pythium, D, none of the above? Which of the following fungi have septate filaments? Because it's a short question, I'll give no more time for it. Coming to the 12th question, which of the following binds to ergosterol? Is it A, fluconazole, B, natamycin, C, caspofungin, or is it D, voriconazole? Which of the following binds to ergosterol? Moving on. Which of the following types of collagen is not present in the Bowman's membrane? Is it A, type 1, B, type 3, C, type 5, or D, type 8? Which of the following types of collagen is not present in the Bowman's membrane? Right, let's move on to the next question. Question number 14. Among the attachments of the vitreous to the retina, which of the following is the weakest? A, ora serrata, B, retinal vessels, C, macula, or D, optic disc. Among the attachments of the vitreous to the retina, which of the following is the weakest? Right, with that we come to the last MCQ, the 15th. Elevation of the upper eyelid on looking downwards and inwards is called the A, Fuchs sign, B, von Graffe sign, C, Ballet sign, or D, Zucker's sign. Elevation of the upper lid on looking downwards and inwards is called which one of these signs? All right, now for the single answer questions. The difference in image size perceived between the eyes due to unequal magnification is called what? There are no choices. You have to write down the answer as legibly as you can. The difference in image size perceived between the eyes due to unequal magnification is called what? Seventeenth question. The triad of upward gaze paresis, poor pupillary reaction to light, and convergence retraction nystagmus is seen in which condition? The triad of upward gaze paresis, poor pupillary reaction to light, and convergence retraction nystagmus is seen in Moving on. What is the most common causative organism of post-operative endophthalmitis? Straightforward question. The most common causative organism of post-operative endophthalmitis. Moving on. The 19th question. Osteosarcoma is the most common second malignancy in the survivors of which ocular malignancy? Osteosarcoma is the most common second malignancy in the survivors of which ocular malignancy? It's a single answer question. Question number 19. Moving on to the 20th question. What is the most common cause of vitreous hemorrhage in adults? What is the most common cause of vitreous hemorrhage in adults? We have 10 more questions left. Question number 21. Persistent dilated pupil after penetrating keratoplasty for keratoconus is called dash syndrome. Persistent dilated pupil after penetrating keratoplasty for keratoconus is called dash syndrome. Right? Move on to the next question. Look at this picture and identify the most likely cause. One is a clinical photograph, the other is a zoomed in area of the photograph, and the third one is an investigation. The most likely cause. I don't want you to identify what it is, I want you to give me the most likely cause. All right? There are going to be some picture questions from now onwards. Simple. You got to identify the structures or the finding marked in red. Identify the finding or the structures marked in red. Moving on. Again, it's a spot identification. One is a photograph, it's a fundus photograph, and the other one is a fluorescein angiogram. And the areas that you have to concentrate are the areas where there are the black circles, not anywhere else. There may be other findings, but I want you to identify the areas in the black circles. All right, moving on. Again, spot diagnosis. Identify this. It's a clinical photograph, pretty straightforward. Right, moving on to the next question. Again, a spot diagnosis of this condition shown in the picture. I would like you to be specific. I think that's enough time. 27. What is the finding in this investigation? What is the finding? I'm not asking for a description of the finding. I'm asking what the finding is. Three more questions to go. Question number 28. Again, spot diagnosis. Look at the clinical photograph and give me a spot diagnosis. Well, we have 2 more questions. I'd like ask the team to get ready to collect the papers after 2 more questions. '29, again, spot diagnosis. There's a fundus photograph and an investigation that's displayed alongside it. Please look carefully at both. All right, we're coming to the last question. And when I say time up, I would like you to keep your pens down when I say time up, okay? Identified. This is an investigation. You have to identify what's been done or what's happened. We'll give you another 20 seconds. All right, pens down, please, and hand over your answer sheets. Have we collected all sheets? Any team left? Any team who has not submitted their answer sheets yet? Please, this side, please. All sheets collected? All are collected? Yep. Thank you for participating, and we'll now go to the answers. Is any team left to give their answer sheets? Can those who are volunteered to do the marking please come forward or raise your hands? I can't find everyone. Sir, please. Yeah, Dinesh. I really appreciate the help that the doctors have extended for helping me correct the answers. The results will be announced later, though. Even though we will be marking now, the results will be announced later. Gopal sir, would you like to volunteer? Harsha, please provide some answer sheets over here. Harsha, shall we begin? The answers. Answers are coming up next. Harsha, use. Can we have the display on the screen? All right, scorers ready. We are starting the marking. All right, the answers. The first question, the answer is SRKT. Which of the following formulae is the least preferred for IOL power calculation in a non-ophthalmic eye? SRKT is more preferred for longer eyes. Hofer Q, Haigis, and Barrett Universal 2 can be used for short eyes. So it's +1 for a correct answer, no negative marks. Shall I move to the next question? If anyone's not ready, please tell me. I'm moving on to next. Anup sir, ready? Thank you. So which of the following is true? The answer is the effective power of a concave lens is decreased as it moves away from the eye. Convex lens, it actually decreases, it doesn't increase as it is moved towards the eye. So the right answer is A. The right answer is A. Ready? Anup sir, ready? You can move on? Okay. Which of the following is true about this picture? Unfortunately, the picture has jumped in front. I don't know why. The correct answer is glass prisms should be held in this position. This is not the frontal plane position, it's the Prentice position, and you should use glass prisms in this position. And the right answer is B. Moving forward. Please interrupt me if you have not finished marking or anything. Okay. So the odds ratio of POAG prevalence, the answer is D. All the rest were just to make you confused. The right answer is D. POAG is almost 3 times more prevalent in African people compared to white subjects. That's what the odds ratio means. It's more of a statistics question than a glaucoma question, but still. Right answer is D. Shall we move forward? Right? Which of the following is true? All are false except C. So the right answer is C. All males carrying an X-linked recessive gene are affected. The other statements are all false. Shall we move? Right? The angle that the superior oblique makes with the optical axis is 51 degrees. The right answer is D. Right answer is D. Shall we move forward? Yes. Facultative hypermetropia is the difference between the total and absolute hypermetropia. All the other statements are false. The right answer is B. Shall we move forward? Which of the following is not derived from the neural crest? The right answer is lens. All the other structures are derived from the neural crest. The lens is from the surface ectoderm. So right answer is C. Shall we move forward? Right. Which is the largest branch of the ophthalmic artery? It's the lacrimal artery. The right answer is C. Lacrimal artery is the largest branch of the ophthalmic artery. C. Shall we move forward? Shall we move? Yes. 10th question, which of the following regarding the lacrimal pump is true? The only true statement is that the lacrimal sac collapses when the eyelid opens. So the right answer is D. Shall we move forward? Yes. Which of the following fungi have septate filaments? The answer is A, Aspergillus. All the other fungi have aseptate filaments. Right answer is A, Aspergillus. Move forward. Which of the following binds to ergosterol? The answer is B, natamycin. The azoles prevent the formation of ergosterol, so does caspofungin, but natamycin is the only one that binds to it. The right answer is B for the question number 12. Shall we move forward? Which of the following types of collagen is not present in the Bowman's membrane? The answer is type 8 collagen, that's D. The right answer for this question is D. All right. Shall we move on? Move on. Among the attachments of the vitreous to the retina, which of the following is the weakest? It's the retinal vessels. The right answer is B. Vitreous is weakly attached to the retinal vessels, to the retina at the area of the retinal vessels. Right answer is B. All right, moving on. Last MCQ. Elevation of the upper eyelid on looking downwards and inwards is called the Fuchs sign. It is seen in aberrant regeneration of third nerve. The right answer is A, Fuchs sign. Okay. Now the MCQs are finished. We are moving on to single answer questions. And here we go. The difference in image size perceived between the eyes due to unequal magnification is called aniseikonia. Yeah, your discretion, but to an extent, yes. It shouldn't be anisometropy or something like that, but small spelling mistakes are okay. Shall we move on? Shall we move on? 17th question. The triad of upward gaze paresis, poor pupillary reaction to light, and convergence retraction nystagmus are seen in Parinot syndrome. The right answer is Parinot syndrome. Even if it's dorsal midbrain syndrome, I think you can give it the same. Shall we move on? Which is the most common causative organism of postoperative endophthalmitis? It is coagulase negative staphylococcus. And need a specific answer for this. Simply staphylococcus won't do. Staph epidermidis is also fine. Staph epidermidis or coagulase negative staphylococcus. Shall we move on? Yes. 19th question. Osteosarcoma is the most common second malignancy in the survivors of retinoblastoma. Retinoblastoma is the right answer for that question number 19. Ready? Ready to move on? Yep. Next question. What is the most common cause of vitreous hemorrhage in adults? Is proliferative diabetic retinopathy. Diabetic retinopathy is also fine. Yeah. Right, move on. Persistent dilated pupil after penetrating keratoplasty for keratoconus is called Uret-Zavalia syndrome. Spellings at your discretion. Right answer is Uret-Zavalia syndrome. Shall we move on? Most likely cause is birth trauma. Those are decimus membrane tears, which are oblique. The right answer is birth trauma or forceps delivery. Shall we move forward? Simply trauma will not. This is a photograph of an adult, by the way. She sustained birth trauma many years back. So that's 22. 23, this is a prominent iris processes, or iris processes also fine. Seen on gonioscopy. Right? Shall we move forward? 24. These are intraretinal microvascular abnormalities, or IRMA. There is an area of neovascularization below, but that's not marked in black. So the right answer is IRMA. Shall we move on? Straightforward answer for 25 is decimetocele. That is a decimetocele. Shall we move forward? Last 5 questions. This is a granular corneal dystrophy. Granular corneal dystrophy is the right answer. Shall we move forward? Yes? 27, it's a serous pigment epithelial detachment, or PED. I think we can give PED also. Yes? Last 3 questions. This is a quite obvious sebaceous gland carcinoma of the upper eyelid. Sebaceous gland carcinoma. Shall we move on? Second last question, this optic disc pit with maculopathy. Optic disc split with serous macular detachment, all that is fine. I like, if it's just optic disc split, I think you can give half marks. No, pit is important here. You need a pit. Shall we move on? This is an intax. Even if they give intracorneal rings, it's fine. But you can't give it for Ferrara, specifically because the cross-section of Ferrara is triangular, whereas intax is hexagonal. Intracorneal rings or intax may be given. All right, with that we come to the end. Thank you all for participating, and we'll be out with the results soon. Our scientific committee chairman will be announcing the results in his own time. So I'll let the suspense hang till then. And relax and enjoy the rest of your conference. I thank all our scorers for helping me with this task. Thank you.